Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we get to talk about Lyme disease. I apologize. There may have been some confusion tonight on the start time. I originally scheduled this so it would begin at 4 p.m., but it looks like the platform that I use uses a time that's based on Greenwich time, so English time, and did not do an adjustment for daylight savings times that occurs here in the States. And so some of you may have gotten notifications saying that the webinar starts at 3 p.m., but actually it starts at 4 p.m. So I'm glad to see that a lot of you are here, but those of you that may have been confused by that, I just want to explain it was a glitch in my webinar platform. So it's good to be here again tonight. I don't have a headache tonight. I know last week we had to shut down a little bit early because I was having a little difficulty, but I'm doing really well here now. In terms of those of you that are new, I'm glad to see new people here. There's a lot of people that are returning as well too, so I'm glad you keep getting value out of this and you keep coming back. The way you participate is two ways. One, you can listen to the responses I give to questions. And the other way is to write questions to me. And the way you do that is on the bottom of your, the right-hand bottom side of your screen is a chat box. You can use that chat box to write questions to me. Realize each time you hit the enter key, it sends a separate question to me. So don't hit your enter key to create paragraphs. In fact, just don't create paragraphs. Just write one long run-on question, but not too long. This format works better for short questions, not for long questions, okay? To the best of my ability, I'll answer your questions tonight. Sometimes you all stump me, and sometimes you give me new ideas. So I'm interested in seeing what new ideas I may get here, and I hope you don't stump me too much tonight. I hope I have some answers for you with the various questions that you're asking here, okay? During the webinar, I am creating a recording, and my intention is to have that edited and have it ready to be out to you somewhere around 9:30 a.m. in the morning Seattle time. One other piece of business. So we will be off the next 2 weeks. Next week, I head back to the Midwest in Indiana to see dear old mom, who's 90 years old, coming up on 91, actually. So I'm going to do an early visit for Thanksgiving rather than get caught in the whole Thanksgiving rush out there. And then we'll be off for Thanksgiving Day. So we'll take up after the Thursday after Thanksgiving will be the next one. When I send out the recording for the email or the email announcing the recording's ready, I will have a sign-up link for the series of webinars that will begin in January. So feel free to sign up and feel free to share that with other people too. In terms of during the webinar, I will be posting your questions. So those of you that are participating in the live version will actually be able to see the question on your screen. For those of you that are not in the live version that are listening in onto the recording of this, I'm going to read those questions out loud so everyone can hear them. Okay. All right. And so without any further ado, let's go ahead and get started. All right. Hello, Rich. Hello. So let's see. These webinars are amazing. Thank you. Let's see. They are greatly appreciated. I have a product here that is a thorn quercetin. Can you explain exactly what quercetin is and how it works? Also, I've noticed that other quercetin products sometimes contain bromelain. Can you also explain what bromelain is and should you take it with quercetin? Also, is the thorn quercetin considered liposomal? Okay, so quercetin, regardless of who makes it, whether it's Thorn or anyone else makes it, quercetin is known as a bioflavonoid. So it's a chemical, it's a bioflavonoid. It comes from, it's found in large degree in onions, but also comes from other vegetables as well too. It has two main functions that I like using it for. One, it's known as a mast cell stabilizer. So mast cells, you may all be familiar with, are cells that produce histamines. And when you're allergic to something, it's the mast cells that are dumping all the histamines out in response to that allergy, okay? Quercetin is known as a mast cell stabilizer. It keeps those mast cells from making and manufacturing and releasing as many histamines. So historically, it's been used most often actually as an anti-allergy support and also as a mast cell activation syndrome support as something you can take to stabilize those mast cells, all right? The other advantage of quercetin is it is a kinase inhibitor. And kinases are enzymes that are found inside white blood cells that are used to produce cytokines, okay? So if quercetin is a kinase inhibitor, it blocks those enzymes that lead to the production of cytokines. And as many of you know, in Lyme disease, one of the big reasons you feel badly, I mean, you heard me say this enough in my webinars, you should know, the main reason you feel bad in Lyme is your immune reaction to Lyme. And the main reason you feel bad when you have yeast overgrowth in your intestines is your immune reaction to the yeast. And the main reason you feel badly whenever you have too many mold toxins in you is your immune reaction to the yeast. And what happens in all those situations is the immune system overproduces these chemicals called cytokines, okay? And cytokines are good and bad. On the good side, they turn the immune system on so that it will start fighting whatever invader you want to fight, whether it's mold toxins, too many yeast in your intestines, or tick-borne infections, all right? But the immune system makes them in excess in these disorders. And in excess, cytokines make it so you can't think, give you fatigue, make you hurt all over, can give you neuropathy, interfere with hormonal function, disturb sleep. See where I'm going? I mean, those are the things we call Lyme symptoms, right? And that's why Lyme looks a lot like mold toxicity that does the same thing, for instance. So we want to limit them. And one of the ways to do that is with quercetin. Now, quercetin, in terms of the Thorne product, it is not a liposomal product. They use a form of quercetin, it's called quercetin calone, that is a well-absorbed form of quercetin, though, okay? But the problem with quercetin is finding a product that has done something to increase its absorption. Sometimes products will use black pepper to increase absorption. Vitamin C at higher doses can also be used to help increase absorption. And the Thorne formulation is actually put together in a way that will increase absorption of it. All right, now you don't need to use it with bromelain. Bromelain is an enzyme that actually comes from pineapple and can be useful for musculoskeletal inflammation, but probably is not that useful in the inflammation that you have in chronic Lyme disease, which tends to be more cytokine based. The bromelain isn't really going to touch it that well, okay? So you don't need to be on that. Now, the dose that you use quercetin at for allergies, I usually have people take it initially as 500 milligrams twice a day. And after about 2 weeks of doing that, then I have them reduce it down to 250 milligrams twice a day as an adult, okay? If I'm using it to manage mast cell activation, as in mast cell activation syndrome, I'm going to dose it at 500 milligrams 3 times a day. And then if I'm going to use it to control cytokines, I'm also going to dose it at 500 milligrams 3 times a day, okay? The Thorne product comes as a 250 milligram pill, all right? All right. Thanks for that question, Rich. Good luck to you. Hello, James. See you, Dr. Ross. It's great that you frequently update the way you treat chronic Lyme. In the last year or so, what changes that you've made have produced the best results? So I put out an email newsletter yesterday and today to 2 different email lists that I have announcing that I have rewritten or updated, significant parts of it significant, updated the Ross Lyme Support Protocol. I'll show you all how you can see that update here in a minute if you did not get that email. But that's what James is talking about. So in there, I have made a number of changes, and I tried to highlight them in what is known as an introduction, and I'll show you what those are. But of those more significant changes, one is really over the last couple of years is I've started trying to add things in to everyone's treatment to deal with persisters. So as I explain in the protocol, and many of you know from participating in webinars, we now know that both the Lyme infection and the Bartonella infection have the ability to exist in 2 different growth states. And those growth states are a growing phase and something known as a persister phase. Think of persisters as hibernating forms of the germ, okay? And these hibernators can ignore regular antibiotics that we have historically used to treat Bartonella and to treat Lyme. If we look at data from research would suggest maybe 10%, maybe up to 20% of your germ forms can exist in these persister phases, it is possible, especially when people have been treated long-term with regular antibiotics or regular herbal antibiotics, that most of their germs may have moved into persisters, and that's why we can't get them better, because the traditional things we use don't touch them, okay? So what I have tried to do in my treatments, there's two major changes that I've made. Number one, if I've got somebody that has does not have active Bartonella or Babesia, they're not well, they've tried a number of things to treat Lyme, and they've done it for a year or more, I usually will try to offer those patients Disulfiram as the only antibiotic that I'm going to use, and that's to treat for persisters, okay? So many of you are familiar with Disulfiram. That is a drug, it's something we've repurposed. It's a drug that's mainly designed to treat alcoholism, but has been shown to have good benefit and able to get about 36% of people that have chronic Lyme into remission. But most of those people that have been studied that you get into 36% get into remission are people that have already done extensive antibiotics to kill their growing forms, okay? So number one, big change is I try to start most people that have done extensive antibiotics already that have never tried Disulfiram. I try to put them on that first, okay? Now, be aware Disulfiram doesn't touch Bartonella, okay? All right. All right. The other thing I will do that's changed is now when I design treatments for Lyme and Bartonella, usually at the very beginning or about a month into starting treatment, in addition to using traditional antibiotics or traditional herbal antibiotics that treat the growth state, I will also have people take something to treat persisters. And my go-to medication that I use to do that is an herbal supplement, which is Liposomal Cinnamon Clove Oregano. And that's one capsule twice a day. And I have found that to make some significant changes. Now, the reason I'm doing that is I've decided it's going to be beneficial to treat both growth phases at the same time. And I'm trying to prevent people from getting into a situation where they're not getting well because we got too many persisters, okay? All right. The other thing, and this is more of a recent change that I've been adding in, but I'm seeing some quite a bit of Herxheimer reactions from doing it, is in my patients that have more severe Bartonella or Babesia, that their treatments seem to be stuck and we're not moving forward with their symptoms about 2 months in, I'm now starting to put people on lumbrokinase, which is an enzyme that can break down a protein in your blood called fibrin. And it looks like Bartonella and Babesia have the ability to form what I'll call fibrin nest, which is basically a mixture of germs and fibrin together that attach themselves to blood vessel linings. And inside that fibrin bundle, it's hard to get the immune system and get the antibiotics in. And so I've started trying to break those down. That's lumbrokinase that I've been doing that with too. Those would be the biggest changes. Let me review the list of changes again too. I'm blanking here real quick. I'm going to do a quick screen share here for you. All right, so this is my Lyme disease treatment site. Okay, so here's the Lyme protocol. And again, I just republished this, okay? So you can scroll down, and basically right here is where we start getting into the meat of the changes. So first of all, right here, you could either read my whole protocol online, and if you do read it online, I've got a lot of links that are active. The other option is you could click on this PDF book of the page here, and it literally prints out a book version of this. It's about 30 pages. But again, it's a book, so it will not have active links in it, but sometimes that's easier to read, okay? This up here is going to give you a list of key supplements that I recommend as part of the core protocol, okay? All right. Now, I did write a foreword to the 3rd edition, and I'm going to click over here to show you. This is basically is the foreword, which says what has changed, okay? And so what I have changed is, again, I'm doing things to treat persisters, all right? And I'm using Disulfiram as part of that, but mainly for people that have failed other regimens that have included both growing and persister antibiotics. I'm going to put them on Disulfiram, okay? The other thing I updated the protocol with is the protocol that I had been using before really only recommended to people within the protocol. It recommended herbal options to treat Bartonella and Babesia. Although I use prescription options as well, the protocol now includes prescription options to start with too. The other big change, actually, I should have mentioned this, is that I've changed quite a bit how I use probiotics, and that I'm finding better results now combining probiotics that have two different general varieties. One of those is using what I call human strains of probiotics. Those would be things that we normally live in our intestines, like Lactobacillus acidophilus, so which would be Lactobacillus species, or Bifidobacterium species, okay? And I like to combine those with soil-based or spore-forming probiotics, which would be from a Bacillus strain. And those spore-forming don't necessarily gain a foothold in your intestines the way the human strains do, but they seem to help the existing bacteria in your intestines work better, and they seem to help those human strains that you take get a better foothold in the intestines too, okay? So the way that you can do that, you can either use a human strain like an HMF Forte combined with a spore-forming strain like a Corebiotic by Research Nutritionals, or Research Nutritionals now has a product that includes human strains and spore-forming strains. It's a product called Multibiome, and you could do that as well too, okay? And then most recently, I have added in Bpc157 as a peptide. I'm still trying, I've added to the protocol based on the reported success a lot of my colleagues are having. It's new enough to me that I'm still really trying to figure out if it is going to make a big difference. I don't have it as part of the core protocol, but I did put it in what I call my special considerations section, which is if everything else is not working, this is something to consider trying, okay? All right, so those are the big things. The other thing I just point out, I know a lot of people have questions about azlocillin and Higromycin A, the two antibiotics that are under development, and I address them here. Higromycin A is an antibiotic recently discovered by Dr. Kim Lewis out at Northeastern University from soil, but it is so new that it does not have any FDA approval yet and will probably take about 8 years to come to market. It's unique in that it appears to target Lyme only, and therefore you would not tend to get disruption of the good bacteria in your gut. The one problem with Higromycin A, though, is we don't know from studies as to whether it will treat growing forms of Lyme alone or whether it will also pick up persisters. And then azlocillin is a drug that was discovered by Dr. Rahadis, who was the doctor that also discovered Disulfiram can help. And it's shown to treat both growing and persister forms of Lyme. However, although it is FDA approved, no one manufactures it. And so there is a company trying to bring that to market, but I bet we're still probably 2 or 3 years away from seeing any help from that as well too. Okay, so those are the big changes. And then again, if you want to read the whole protocol online, you can read it through here. Or you may just want to go ahead and click on the book and download the book as well too, okay? All right. I hope that answers your question. Oop, I think we got that taken care of. Okay, very good. I know it's a little long-winded, but I just wanted to show everyone what we're talking about here too, James. Thank you. All right. Hello, Dave. Let's see. Do you ever recommend an inositol? Can barely even say the last word. I'll just call it an inositol hex, okay, for circulation problems. What is the typical amount you would take daily? I have been treating for Lyme, Babesia, and Bartonella for 2 years now, and all of my symptoms have improved except for my circulation to the small blood vessels. I have cold feet and legs, as well as wrinkled, pruny fingertips. I have tried lumbrokinase, ginkgo biloba, and many other herbs, but I have not been able to solve the circulation issue. My circulation is bad most of the time, and cold temperatures make it worse. Unfortunately, I don't have an experience working with inositol for that purpose. And I'm not familiar with the science on that one either, okay? You're already doing what I would have suggested, which is work with lumbrokinase, So some people, Dave, you know this, but I'm going to explain to everyone else. So one of the things that can happen when you have chronic infection, like Lyme, Bartonella, any kind of chronic infection, is the immune system in responding will manufacture what we call acute phase chemicals and acute phase particles. And one of those is fibrin, the blood clotting protein that I mentioned earlier, okay? And fibrin gets into the blood. And the trouble is if the immune system is making too much fibrin, it starts clogging up the flow of your blood. Your blood doesn't flow as easily into the small blood vessels, okay? So one thing I will try when people have circulation issues, as you're suggesting you are having, is I will try lumbrokinase, okay? And that is to unthicken the blood, if you will. You do that 20 milligrams twice a day. Ginkgo biloba has the ability to make red blood cells more flexible and helps blood flow more easily as well, too. So it's another way of unthickening your blood, if you will, too, all right? Now, the other thing that I'll just throw out, and I don't know enough of your story here, but there is an autoimmune condition that sometimes people can get as part of Lyme and even as part of arthritic conditions. And that situation is called Raynaud's phenomenon. And what happens in Raynaud's phenomenon is, as part of an autoimmune illness, your blood vessels can more easily go into spasm during temperature fluctuations. So either you go into a hot room all of a sudden, or you go into cold. Either one of those can trigger your blood vessels to spasm. And in that situation, people will get white or painful fingers and feet that get worse in cold situations or in hot situations. One of the things you can do to block the blood vessel spasm in situations like that, I will try a lumbrokinase, I'll try a ginkgo biloba, but if everything isn't working, sometimes you have to use drugs. And the two families of drugs you can use to prevent that spasm, to keep the blood vessels from spasming, is would be nitroglycerin, which we use for people with heart disease, for instance, or another heart group of medicines called calcium channel blockers, which one would be Norvasc is one, and one is Procardia. There's a group of those. They block calcium channels on your red blood cell muscles, making them so they relax and they don't go into spasm. Those are some other things to consider doing as well, too. Okay? All right. Thanks for the question, Dave, and good luck to you. Hello, Sid. Let's see, what's your opinion on taking oral IgG bovine and other immunoglobulins to assist the immune system? The only way that I think it is in my opinion, and I'll say it's my opinion, others may have different opinions. I think it's beneficial to take immunoglobulins like IgG if you have low immunoglobulins. But if you are already making enough yourself, and the way you would determine that is a blood test, if you make enough, I don't think you need to be supplementing it, okay? All right. Good luck to you, Sid. Hello, Chris from Canada. Hello, Anna. Hello, Dr. Ross. Can oral itraconazole for treatment of yeast overgrowth cause Herxheimer? Also, does it usually cause altered taste and smell? If so, will the symptoms go away after the medication is discontinued? Thank you for the webinar. You're welcome. So it does not often give taste and smell, but it can be a side effect. And I would anticipate that it's going to go away once you come off the medicine. It's been my experience as I've worked with that medication with people, okay? So itraconazole, everyone, is an anti-yeast medicine that is in a family called the azoles, okay? The reason it's in an azole family, see how it ends in A-Z-O-L-E? That's an azole, all right? So the other more common azole that many of us use to treat yeast is fluconazole, which is diflucan. The difficulty is that we're starting to see increased yeast resistance to diflucan, so therefore we're looking for other azoles we can use, and one that does a pretty good job is itraconazole. Although it's not necessarily approved to treat yeast, it can still do a good job. It's approved actually for toenail fungus, but it is something that works quite well. In terms of can you get a Herx? yes, when you kill yeast, it can trigger a Herxheimer reaction. So what's a Herxheimer reaction? I think many of you know, but for those of you who don't know, Herxheimer reactions are basically a result of killing germs. And when you kill germs, certain germs, not all bacteria, not all yeast, but sometimes when you kill yeast and you kill bacteria, the immune system will see those dead bug parts and react by making more cytokines. All right. So you already know what cytokines cause. They give you most of the symptoms you have of Lyme, or most of the symptoms you have of mold toxicity, or most of the symptoms you have of yeast. So if you get a surge in cytokines, you're probably going to have more body pain, more fatigue, more difficulty thinking, maybe more sleep disturbance. That's called a Herxheimer reaction, okay? So technically a Herxheimer reaction is what occurs in reaction to more dead bug parts from killing. And yeah, it can happen when you treat yeast. All right. Good luck, Anna. Hello, Tim. Let's see, Dr. Ross. Thank you so much for your kindness. You're welcome. Let's see, I'm curious to know what infection in your experience is usually responsible for extreme debilitating fatigue. I am positive for Lyme. However, after reviewing the co-infection symptom list many times, I can't figure out if it's Bartonella, Babesia, or Lyme causing my extreme fatigue. It seems like they can all cause it. All right. So a good question. I mean, basically all of them can give fatigue, but the one of those in my experience that I find to be the most fatiguing is Babesia. Babesia can give just really, really quite a bit of fatigue. That's not to say the other ones don't too. All right. So I'm just giving you a generality. If I had to pick which one is likely to have the greatest chance of giving severe fatigue, it would be the Babesia. Yeah. Anyhow. All right. Good luck to you, Tim. Oh, one more thing. So, but you got to look to make sure you don't have other symptoms suggesting Babesia too. All right. So, because all of these can give some degree of fatigue. If you're going to make a decision to treat Babesia, I would not make it just based on the symptom of fatigue alone. Okay. So other symptoms that can look like Babesia are drenching night sweats, air hunger, feeling like can't get enough air from time to time, racing and skipping of the heart, getting lightheaded easily on standing, frontal headaches, bad migraines sometimes can be part of Babesia. And another unique symptom for Babesia is frequent deja vu experiences. All right. Okay. All right. Good luck, Tim. Hello, Lynn. Let's see. I'm interested in including Bpc157 in my supplements, and I'd like to look into safety and efficacy a little further. Do you have any trusted sources of information that could read about this? Can you speak about what you heard at ILAD's meeting that persuaded you to start using it? Thanks for all of your help. So, Bpc157 has got, I don't have a single source for you to go look at, but what I can tell you is if you could do your own what's known as a Medline search or a PubMed search. So if you just Google PubMed, that is a resource that you can look at scientific articles, all right? And just write in the top Bpc157 or body promoting compound, which is what it is, and you'll find some scientific articles on it, all right? It is a peptide that is naturally made in the stomach, all right? And therefore, it's natural. And in terms of potential side effects, there really aren't much potential harm, probably not much. Mostly, though, over the last years, most of these peptides have been given to people in an IV formulation. And where I've become interested in peptides is I've been participating on discussion boards with my colleagues that treat Lyme and seeing some of the things they're reporting in terms of improvement, which is what led me to think maybe I start adding this into my practice. As I've looked at some of the basic science on some of them, I think there's enough science to support potential benefit. What I will tell you is none of them have been researched in Lyme disease, though. Okay, so even though we're applying them in Lyme disease, there aren't specific research protocols that have been done, published, looking at the effect in Lyme. Of all the peptides, the one that I decided to start working with first is the one that I think can give the most benefit, and that's because it does a number of things. So Bpc157 is a peptide that's made in the stomach, And it's known to help improve intestinal function and repair intestinal injury, basically, okay? But it has also been shown to be useful for athletes that have muscle, tendon, and joint injuries. It's been used for quite some time to help with repair in those situations. So we know it has a reparative function. The other thing it's been shown to help with is to balance your immune system, to get better balance between what is known as Th1, Th2 inflammation. Th1 would be the cells in your immune system that fight infection. All right. Th2 would be your B white blood cells that make antibodies, and also your mast cells and your autoimmune system. And one of the things that can happen sometimes is you get an imbalance where you start getting too much Th2, which suppresses Th1, making it hard for your cells to fight infection. All right. So Bpc157 can rebalance that. So based on the workshop that I was at ILADS and ongoing discussions I've had with colleagues over the last year, I've decided to start adding it into treatment and seeing. The other ones that I will be adding in also would be something called a TB thymosin, thymosin or TFrag. It's a thymosin peptide. I'm blanking on the name of it here. Hold on just a minute. TB4 frag, that's what it is. TB4 active frag, and which is a peptide made by the thymus gland. It also can help balance the immune system, has some ability, not so much on the tissue repair side, but more of an immune balancer. The people that have been using this for a while in the Lyme circles all suggested actually starting with the Bpc157 first as your foundation, then come back and add in your TB4 frag. And then if there are other peptides, because there's other peptides we can use too, then you would add those in next, basically. All right. Now, historically, peptides have been done IV, and in an IV form, they're extremely expensive. There is a company that has been developing oral preparations, and they now have a number of those. One would be the body promoting compound, the other one, or the Bpc157, the TB4 frag plus, something called cerebrolysin, which can help with thinking, something called KPV, which can help with mast cells to stabilize those. Okay, those are all made by a company called Integrative Peptides. I've decided to try the oral formulations of them rather than sticking people with the expense of the IV forms. And it's the Bpc157 that I said in my new protocol, give it a try. And that's based upon what I'm hearing from my colleagues, and that's based upon my review of the science. As you know, my protocols are a work in progress, and I may make it a core part of treatment. I mean, if things look good, I may start people on it right away, but that's not where I'm at this point. Okay. All right. Good luck to you, Lynn. Hello, Chris. Let's see. What's the role of antibiotics versus herbs in treating chronic Lyme, concurrent or sequential? So I like it. So in general, so I think there's, I'm trying to figure out how to explain this. So there's two different groups of things, antimicrobials, okay? There's prescription antimicrobials, we call those prescription antibiotics, and there's herbal antimicrobials, we call those herbal antibiotics. I don't think you necessarily need to be on both if they're doing the same things, all right? So herbal antibiotics, when it comes to Lyme, the various protocols I work with, on the whole, have as good of a chance of helping you as prescription antibiotics, all right? I explain that in my protocol, all right? On the other hand, when it comes to treating Bartonella, herbal antibiotics have about a 10% less chance of helping compared to prescription antibiotics. And then when it comes to Babesia, herbal antibiotics have about a 5% less chance of helping compared to prescription regimens, okay? All right, that's just common things, all right? Now, can you put herbs and prescription antibiotics together? Yeah, you could, but you're increasing your risk of toxicity and increase the severity of Herxheimer reaction, and you're taking another bite out of your pocketbook you may not need to. So I don't think you necessarily need to do all together. There is one situation where I do like using prescriptions necessarily with herbal, and that is in my Lyme germ treatments where I'm trying to treat spirochete and cyst. I like using prescriptions often to treat the spirochete. And for the cyst, I like using grapefruit seed extract. I like using that combination. I find good benefit doing that. I find, and the reason for that is sometimes the drugs we use to treat cyst Lyme, which would be the tinidazole, metronidazole, rifampin, can be a little bit more harsh, but sometimes they're reasonable to use too. Okay, all right. Good luck to you, Chris. Thanks for the question. Hello, Natalie. Let's see. Hi. Could you comment on the relationship between thymosin beta-4 and Bpc157? What should we consider before adding one or the other? Also, can you comment on oxalates? Okay, so I already gave you my comments on the Bpc157 and the thymosin beta-4. All right. And so, again, I would start with Bpc157. You can start at 1 pill twice a day. Work up. You could even work up to 2 or 3 twice a day. I would start at 1 twice a day. In about a week, you could go up more. And then eventually at 3 weeks, you could go up to 3 twice a day. It's expensive though. Okay. Once you're stable on that, then you might consider the next step would be to add in the thymosin beta-4 and see if you get better help with how your immune system is functioning and better help with symptom resolution. I like Bpc157 again as a starter because in addition to helping the immune system, it does a lot more in terms of tissue injury and repair. Okay, that's why I tend to like it quite a bit. All right. All right, then let's see. Oxalates. So oxalates are chemicals that can accumulate in your body, and they have an inflammatory potential. And some people do build up levels of those, and it can become part of the inflammation problem. The way to see if it truly is causing a problem, would be to go on a low oxalate diet for like about 3 weeks to 4 weeks, and then add them back in and see, do you get worse? If you don't, you may not have a true oxalate problem, even though you have higher levels of it. Okay. So in other words, challenge yourself to see if there's a problem. That's how I approach it. All right. And then let's see. Yeah. Anyhow. All right. Good luck to you, Natalie. Hello, Sharon. See, dear Dr. Marty, thank you for sharing your knowledge with us. You're welcome. I have 3 questions. I am interested in Igenix Bartonella panel. Can you comment on what products one should avoid prior to the blood draw and for how long? I'm wondering about the following: prescription antibiotics and antifungals, herbal antibiotics and herbal antifungals, and methylene blue. Number 2, how long must one typically stay on lumbrokinase? Number 3, can binders be taken together in various combinations, or are there some that must be taken separately? I'm wondering about the following: cholestyramine, bentonite clay, charcoal, zeolite, pectin, and modified citrus pectin. Okay, let me try to work through this in the top to bottom here. Okay, so number 1, the Bartonella panel. So it depends on what you mean by the Bartonella panel, so I'm going to explain that. So Igenix has a number of ways of doing Bartonella. You can get something called a Bartonella Immunoblot, which is looking to see, does your immune system make antibodies that attach to the family of Bartonella and 4 specific strains. So it's an antibody test, okay? Also, Igenix does another test, which is called a Bartonella fish test, which looks to see, is a way of looking to see if you can see Bartonella under the microscope. Keep in mind, Bartonella likes to live inside a cell, so we may not find it in the blood easily, okay? But it's looking at, can you see it under the microscope? And the way that you see it is they apply a fluorescent tag to the germ. So you've got to have it in the blood to be able to see it, okay? And then I believe Igenix is still doing a PCR test for Bartonella too, all right? So in terms of the antibody test, the Immunoblot actually may look better if you're on things that kill Bartonella. So all those things you were talking about would maybe even enhance the chances of getting a positive Immunoblot test, okay? Your fish test and a PCR test, which is based upon how much germ load is in the blood, you're going to have a harder time finding Bartonella if you're killing things at the same time. Okay? So, of all those tests, though, the one that has the greatest chance of finding Bartonella is the Immunoblot. That's where I would start first. I wouldn't waste my resources doing a fish test, and I would not waste my resources doing the PCR test. Because, again, Bartonella lives in cells. It doesn't readily live in the blood. And even though we can try to look for it in the blood, the yield of it is going to be quite small. All right. So my recommendation to you or anyone that would ask me a kind of question like this is stay on your germ killers and go ahead and get your Immunoblot. I wouldn't even waste resources doing the PCR or doing the fish test. Okay. All right. Number two, how much? So lumbrokinase, as many of you know, I'm recommending it, especially I'm recommending it in situations where it's hard to treat Bartonella Babesia. I think it's worth a 3 to 4 month try, to be honest with you. Give it that length. That's based upon just my starting experience with it here, but also one of the presentations at ILADS was given by a physician that's been having experience of great benefit working in lumbrokinase into his patients, but it's something he uses on an ongoing basis, and he's getting good results that way. Okay. All right. Let's see. Number 3, can binders be taken together in various combinations? Yeah, you can take them in combinations, but cholestyramine basically covers everything else all those other binders would take. So I don't think you need to do cholestyramine and all those other ones, okay? So you could do cholestyramine. Then you could do natural binders. In terms of natural binders, you could do the bentonite clay, charcoal, and zeolite and pectin, all kind of work differently on their own. You could combine those together. But an apple pectin and a modified citrus pectin are the same thing. You don't need to do duplicates on that one, okay? And technically, zeolite is probably zeolite clay. It would replicate what the bentonite does, all right? So you could either do cholestyramine, or you could do bentonite clay or zeolite with charcoal and pectin, one of the pectin products, and probably equal what you would be doing with a cholestyramine. The benefit of doing that instead of cholestyramine is constipating, and these other things probably are not constipating. Okay? All right. Good luck to you, Sharon. Hello, Kate. Let's see. Do you ever see loss of immune tolerance during and after Lyme treatment? I believe I lost immune tolerance to Candida after getting a Candida overgrowth on antibiotics. I don't have reason to believe or suspect continuous Candida overgrowth at this point, but I have tested positive for a Candida allergy, and I have chronic eustachian tube dysfunction after the use of antibiotics and herbal antibiotics. I don't know so much about tolerance, but what I can tell you is I'm going to reframe it a different way. And that is having chronic infection in you can sometimes lead to mast cell activation. Okay. So again, mast cells are the type of cells that line or that are involved in allergic reactions. And we historically only thought they were involved in allergies, and that basically something you were allergic to would attach itself onto the mast cells, and they would manufacture histamines, and then you got the whole allergic response from the histamines, okay? What we now know, though, is that those mast cells can be turned on actually by infection. They can be turned on by stress. Actually, stress is a big provoker of your mast cells. And they can be turned on by various chronic infections like viruses, like Lyme, and they can be turned on by mold toxicity, all right? And once they get turned on, it's kind of hard to get them unturned on. And once they get turned on, they're easily provoked and will keep making too many mast cells unless you do something to intervene, all right? So the interventions are taking care of all those things that can provoke them, all right? So like a Lyme, a mold, virus infections, anxiety is like your biggest one, okay? All right. And then getting on some things to stabilize those mast cells, like a quercetin I mentioned earlier, or a luteolin, okay? So what you might want to do, Kate, I'm gonna show you my mast cell activation article here. I would read through it, you might want to look, and I don't know your history, you'll know better than me, but whether you've got some of the infection or mold problems that I list there, and make sure you've dealt with those. And then you can look at some of the supports you can use to quiet your mast cells down. You might want to take a look at that. Okay, let me show you that article here. All right, so take a look up here in the immune chapter, or immune system chapter. And then this article called Mast Cell Activation in Lyme. Okay, and here I talk about things that can trigger it. I list them up here. Actually, where do I list them? They're somewhere in here. And I talk about the symptoms you can have for it. And then I talk about how you go about working it up and considering it as well too. Okay. And I give you action steps you can take down here about how do you start reducing them. Okay. All right. All right, Kate, good luck to you. Hello, Gail. Let's see. Hi, Dr. Ross. A few questions. Could fibrin nest occur in toes? I have severe blood vessel dysfunction in my toes that's painful and constant and have always felt it's from BART. Could I get fibrin nests in the blood vessels of my toes? And if so, could this cause pain too? How valuable is a high-quality infrared sauna and detoxing? It's a big investment, so curious if you think it can be a game changer for detoxing. 3, I have read thymosin alpha-1 to modulate your immune system should be taken before taking Bpc157, especially with impaired immune system Lyme disease. What are your thoughts? Also, could you use Bpc157 concurrently with antibiotics regardless of what stage of illness? Okay, so I'll talk about your last question. So again, thymosin alpha-1 or TB frag or TB frag plus, all of those can be taken after you start your Bpc157. That's the predominant way that most of the speakers at this conference were using it, and that's how I've been starting it, okay? Number 2, can you use these concurrently with antibiotics? Yeah, there's no reason you can't use them at the same time as using antibiotics, and that's how a number of the speakers have been using it in their practice as well, too, okay? In terms of detoxing, so detox, I just want to talk quickly about detoxing. So when you, the 2 detox organs in the body are your kidneys, which remove water-soluble toxins, and your liver, which removes fat-based toxins, and your skin, which the third one would be your skin, which also can remove fat-based toxins. All right. So when you, so the main thing that I like people to do with detox is I like to do things to support the liver. So the liver can adequately transform fat toxins that get to it through the blood from fat-soluble toxins to water-soluble toxins, so they can get mixed into your poop and you poop them out. They don't bother you anymore. Okay. So the main chemical that does that is glutathione. So a central part of detoxing is make sure you're taking glutathione if you have a condition that's producing toxins. And in Lyme, you can have conditions that produce toxins. Okay. Number 2, you've got to make sure you're pooping. All right. And the reason you want to do that is so the liver, again, takes these fat-soluble toxins and makes them water-soluble. And the way it makes it water-soluble, it sticks a water-soluble chemical group on these fat toxins, okay, which makes them water-soluble, all right? If they go into the intestines and if the transit time, the amount of time it takes to move through your intestines is too slow, bacteria that line the intestines can start breaking off these water groups. And guess what? They become fat-soluble, and you reabsorb them back into the bloodstream again. All right. So second thing, I like to make sure people are having at least one good bowel movement a day. If not, I want to give them something to have good bowel movements. Okay. It could be magnesium, could be vitamin C. All right. All right. All right. So all right. So that's part of the cornerstone of doing fat detox is liver support and poop. All right. Just basic fundamentals there. Okay. So what does an infrared sauna do then? So when you do an infrared sauna, it heats you up, and that heating up will help mobilize toxins out of the tissues and move them into the bloodstream. Those toxins then can do two things. They either go to the liver, and the liver then transforms them into water-soluble toxins and moves them out into your intestines, and you poop them out, okay? Or 20% of them will sweat out, all right? So infrared sauna will help you sweat out toxins, but keep in mind the effect of toxin movement is that 80% of those toxins actually go to the liver. So even if you're going to do an infrared sauna detox, support your liver and poop, okay? I just want to be very clear about that, all right? Okay. So is it a game changer? I don't know if it's a big game changer. There's some people that do get benefit. I would say on the whole, it's another help, but it's an expensive help, all right? There's other ways you can sweat. Take a hot bath. If you're able to, go for a walk. So you can sweat in other ways, all right? So, but it can. I mean, some people get benefit from it, but as in terms of a big game changer, I don't necessarily think so. Okay, all right. And then let's see. Fibrin nest. Okay, so fibrin nesting can occur in every blood vessel in the body. Okay, including the small blood vessels down in your feet. So could it be something that is limiting blood flow into your toes? Yeah, it could. It could be clogging up, making your the opening of your blood vessels more narrow. It's possible. Okay, so limited blood flow caused by those fibrin nest deposits on your blood vessel linings could lead to some pain. So it's possible. Okay, all right. So I think I answered all parts of that. All right. Good luck to you, Gail. Hello, Juliana. Let's see. Hi, Dr. Ross. I did a stool test and my streptococcus and staphylococcus were both high and my secretory IgA was low. What typically causes these to be elevated? And what types of natural products do you suggest to take care of them? Thank you so much. So I'm not clear. I would need to know a lot more of your story to answer specifically on this, okay? But when you have an imbalance in healthy bacteria, meaning you have too much of things that aren't supposed to be there and not enough of things that are supposed to be there, one of the foundation supports is take probiotics, all right? So take probably a good strain of probiotics that would be have both the human strains I was mentioning earlier as well as the spore-forming strains, all right? The second thing you want to do is feed good bacteria. And to feed that good bacteria is to use the best food source for good bacteria in your intestines is soluble fiber, all right? So you could Google a list of soluble fiber foods, and you would find foods that are rich in soluble fiber. One of the best ones is avocado. And you could try to take maybe half an avocado a day, for instance, or emphasize other foods that have soluble fiber because they're going to feed the good bacteria in your intestines, all right? All right. So there's a saying that we have in integrative medicine about intestinal dysfunction and intestinal germ imbalances. And that is we say weed, seed, and feed, okay? So feeding is soluble fiber. Seeding is putting good bacteria in, all right, and weeding. Sometimes if you've got an imbalance of bacteria that isn't supposed to be there, you got to kill it, all right? I don't know what your load is here, so I can't say whether you need to kill it or not, to be honest with you, okay? And in terms of the secretory IgA being low, that secretory IgA, those antibodies are the type of antibodies that line the intestinal mucus and your nose mucus and your lung mucus, okay? And they're what are supposed to block invaders on the front porch before they get absorbed into the house, into your bloodstream, basically. I'm not quite clear how to raise those when they're low. When I do see a picture of them being low, it can explain why people have a harder time fighting off infections, that things keep getting into their bloodstream and causing them problems because they're not being blocked at the front door, basically. Okay? All right. Good luck to you, Juliana. Hello, Alex. Hi, Dr. Ross. Thank you for your time. I've been taking 1,000 milligrams of nitoxinide a day, 100 milligrams artesunate, 200 milligrams minocycline, 500 milligrams azithromycin for 7 months, and rifampicin for 2 months. I've seen little or no improvement in my symptoms. Is this normal? How long should it take to notice a change? And when should I stop treatment? Thanks so much. All right. So Alex, I have no idea what your conditions are to let you know for sure, right? Because I mean, I know obviously this forum doesn't let me figure out whether you have Lyme, Bartonella, Babesia, et cetera, okay? I'm going to make an observation though. I know a number of my colleagues use Alinea, which is nitoxinide, to treat Babesia. I don't find it to be that useful, okay? So if you have Babesia and you're really not seeing any major changes here, you may want to relook at whether you should be on that, all right? So the artesunate, minocycline, azithromycin can sometimes also help Babesia, but they're not going to be enough. You need to use some kind of a strong antimalarial. Your providers may be using nitoxinide here to do that, but I would tell you, I just don't find it to be that useful. I know it's an anti-parasite, but it's made for anaerobic parasites, ones that require oxygen. Babesia is a parasite that lives in oxygen in your blood cells, so it doesn't make sense that it would really do much. I've tried using it for Babesia before, and I haven't found it helpful, okay? Your other parts of your treatment, minocycline, azithromycin, rifampicin, would treat Bartonella, and minocycline, azithromycin, rifampicin would also be a full-on Lyme germ treatment. There is nothing here that you're doing, though, that deals with persister Lyme and Bartonella, so that might be something to consider adding in. And again, if you have Babesia and Bartonella and you're not getting better, per my new protocol, you might want to start thinking about adding in lumbrokinase to deal with fibrin nest. Okay, take a look at my protocol on that. All right, now let me give you a bigger overview here, though. All right, so when somebody has Lyme infection, and the symptoms that we associate with Lyme infection are the major cause of your symptoms, when you're in that situation, here's what we know about how quickly people improve. So there was a study done by that was presented at the annual ILAS meeting maybe over a decade ago now, looking at how long would it take to turn the corner on a chronic Lyme infection when a person was on 2 antibiotics. And those 2 antibiotics were clarithromycin, which is in the same family as the azithromycin you're on, and metronidazole, which is Flagyl, all right? And on that regimen, what was shown is that by 3 months of treatment, only 30% of people started to improve. By 6 months, 60% of people started to improve. And by 9 months, 90% of people started to improve, okay? So the key thing I want you to understand, if the Lyme germ is causing most of your problems, it still may take more time to turn the corner, unfortunately, okay? Right now, Bartonella and Babesia both replicate more rapidly than Lyme does. So Lyme replicates every 4 weeks to every 8 weeks. Things that grow slowly take longer to respond, okay? Right. So Bartonella and Babesia, because they replicate quickly, if you are on a right treatment that is working against them, you should start to see improvements in those specific symptoms for Bartonella and Babesia by about 1 to 2 months. If you do not, then you need to change to a different regimen because the current one's not working. Even if it's supposed to, not everything that's supposed to work works, okay? All right, so from a time standpoint, Lyme can take forever to turn the corner, unfortunately. Bartonella Babesia, though, if you are on an effective treatment, you should start seeing improvements in the symptoms that we attribute to Bartonella and Babesia by around 1 to 2 months, okay? So what are the Bartonella and what are the Babesia symptoms that might start getting better? Let me show you a list of where you can look at what those symptoms are. Okay, so to see what symptoms that I say are Bartonella and are Babesia treatment, take a look at my chapter on how to diagnose. And take a look at this article called How to Diagnose Bartonella. That'll have a whole list of Bartonella symptoms. and take a look at this article about how to diagnose Babesia. And in here, you'll find a list of what I would say are more Babesia symptoms, okay? All right. Good luck to you, Alex. Hello, Anna. Hello, Dr. Ross. Is hardened oval shape of skin on the sole of the foot underneath the toes a manifestation of Lyme or co-infections? What about singular itchy pimples appearing very frequently and anywhere on the body? Thank you kindly. So I don't think of your foot symptom as necessarily being something that is from Lyme and co-infections, all right? I don't think of it as an average thing I would see. In terms of itchy pimples appearing infrequently, sometimes I have seen a situation like that associated with too many yeast growing in your intestines, all right? So I'll show you an article you can look at to help you figure out if you have too many yeast. And let me show you that so you can look at that and figure out if that might be your situation, all right? All right, so take a look at my yeast section here. And take a look at this article called A Silent Problem, Is It Yeast? And it gives you a list of symptoms to consider that could suggest you have too many yeast in the intestines, okay? And yes, if you have too many yeast in the intestines, that can lead to skin issues. That's what I'm trying to tell you, all right? And the reason it can lead to skin issues is that basically yeast overgrowth in the intestines, the yeast release toxins. Those toxins get absorbed into your bloodstream, and when they interact with the skin, can lead to skin manifestations, okay? All right. All right. Hello, TJ. Let's see. Are there particular markers or yellow or red flags that would cause you to suspect cancer with a weakened immune systems from Lyme? Let's see. Are there particular markers or yellow or red flags that would cause you to suspect cancer with a weakened immune systems from Lyme? And what would make you look in that direction? Do you ever see glutaric acidemia on the organic acid test? Is that related to Lyme or separate genetic problem? All right. So, you know, there is some suspicion that Lyme could be involved in increasing cancer, and but we don't have solid evidence of that. All right, and therefore there are no solid markers that we would follow in Lyme disease to suggest cancer or not. I would, you know, whenever I'm evaluating somebody, I'm always thinking, what could it be? Is this all Lyme, or is there a possibility of other illnesses? And yeah, I'm always considering, could there be cancer? Depending on what the symptoms are, I might do some testing or imaging to help look for that possibility, but there's no general testing that we would do for that possibility, okay? All right, so Dr. Neil Spector, many of you may know, is a physician that died of Lyme disease after, and as part of his illness, developed heart condition where he had to have a heart replacement. Some of his work before he died was looking at cancer and Lyme disease. And you might even Google him and see what kind of work you can find on that. I'm not as familiar with it as I could be, but his name is Neil Spector MD. And you Google Neil Spector MD and Lyme and cancer and see if you can find some of the work that he was working on, okay? Let's see here. You know, in terms of glutaric acidemia, I know this stuff shows up on the organic acid test. In terms of organic acid testing, the only thing I have ever really found it to be reliable for to make a difference is looking at the fungal markers. And if there is elevation in arabinose in the fungal markers, that can sometimes indicate too many yeast in the intestines. Beyond that, I don't find following those organic acids to be that useful. Okay? All right. Good luck to you, TJ. Hello, Chris. Let's see. I recently lost my LMD who was forced into premature retirement. Not sure about where to go from here, literally, since I live on the east coast of Canada. It's a problem, especially in Canada, because basically the docs in Canada that treat Lyme across the board eventually lose their licenses. All right. There are some that are out on the west coast that are still doing it. Dr. Hawkins in Alberta. But even Dr. Hawkins has had to kind of limit how long he treats people to kind of stay away from getting into trouble with the authorities out in Alberta as well, too. In Canada, there are a number of naturopathic doctors that are treating, but out on the East Coast, like in the Maritimes and into Ontario, there is an internist, I believe, in Ontario. I think, and I can't say his name here. I don't want to say his name here, but there is an internist out there doing it. At this point, as the borders reopen again, you may need to look at coming back down into the States in terms of who is out in Maine, who is out in upper New York State, who is out in that area. I would reach out to ILADS, ilads.org. On the contact page there, they have a doctor finder, and you could look and see who's treating in those areas. Okay? All right. Good luck to you, Chris. Hello, Mildred. Let's see. Are there alternatives to aspirin for blood thinning? Too much aspirin causes stomach aching. And what is your take on cholesterol medicine? Doctors in my parts want to put you on Lipitor with ever increasing lower targets a cholesterol. All right. So, Mildred, it's hard for me to answer your question because I'm not sure why you're doing blood thinning. Depending on what your condition is, aspirin may be the way to do it. If you're trying to thin your blood because you have a chronic infection that's clogging your producing too much fibrin, in that case, lumbrokinase might be good. So, and if you've got a heart valve problem, aspirin may still be the best way of going. So, anyhow, I would need to know more about your situation to say what's the best way to go. In terms of cholesterol, I would need to know more about what your numbers are. And so I'm sorry, I can't give you advice here. Okay? All right. Good luck to you. Hello, Sandra. Let's see. Is the Lyme Immunoblot test reliable, accurate? How do you treat Lyme-related small fiber neuropathy, pain, muscle weakness, etc.? Is it common? Do you ever recommend IV ceftriaxone for neuro-Lyme? Thank you. All right. So in terms of Lyme testing, I think these days the most reliable at finding it and when a test comes back being accurate test is the IGeneX Lyme Immunoblot. Okay. Hands down, it's the best test out there. And here's why I'm saying that. So the Immunoblot is a way of seeing, do you have an immune reaction against Lyme? It's looking to see, do you make antibodies that attach to Lyme? What IGeneX is doing with its Immunoblot is looking to see if you make antibodies against 8 different strains of Lyme. That compares with the old Western blot from IGeneX, which looked to see if you have antibodies against 2 strains. And it compares with the Canadian method of doing a Western blot and the standard U.S. method of doing a Western blot that you would get through LabCorp or Quest, where they only look to see if you have antibodies against 1 strain. And it's the original East Coast strain from the 70s, okay? Surely things have evolved since then, all right? And IGeneX has, all right? Now, the strains that the IGeneX covers, of those 8, one is the original strain, okay? But 2 of them are European strains that have migrated across the pond and are now out on the East Coast, Canada, East Coast, U.S., and working its way into the U.S. now too. And that is Borrelia afzelii and Borrelia guarinii, okay? So first of all, the reason the Immunoblot is a good test is it gives you a bigger fingerprint because it looks for 8 strains, okay? Number 2, the big risk we run in any test, whether it's the Immunoblot, Western blot, or whether it's an Armin Labs ELISpot, or it's an Infecto Lab ELISpot, that Armin lab and InfectoLab ELISpot is a way of measuring, do your T white blood cells react against Lyme? Okay, so there is immune testing as well too. Okay, but the biggest problem we run with all of these is false positive tests. All right, and the way that that IGeneX tries to get around the false positive, a big reason for false positive testing is that when you have some chronic virus infections, they can create antibodies that wrongly attach to the Lyme proteins that you're testing for. Okay, so what IGeneX does is they clean up these proteins. They use genetically modified proteins from these 8 strains that remove the pieces that might falsely hold on to virus antibodies, leading to a false test. Right. So they use cleaned up proteins. So they test for 8 strains and they use cleaned up proteins. It looks like, based on their validation studies, that it will find Lyme if it's there about 95% of the time. And when it finds it, it is correct about 100% of the time. It's a good test. Okay. In terms of repairing small fiber neuropathy, depends on how severe it is. I mean, if you've got really severe small fiber neuropathy, sometimes a good treatment would be to do IVIG, IV immunoglobulins, all right? But ultimately, what you want to do to stop injuring the small fibers of your nerves is get the thing that's assaulting them under control. And that could be mold toxicity if you have mold toxicity. It could be Lyme. It could be Bartonella, all right? So figure out what the thing is that damaged your nerves to begin with and get rid of those, okay? So treat them, all right? Number 2, what I like to do with small fiber neuropathy is start to do things that support healthy nerve function and repair. So again, get the infections out. Okay. Number 2, get inflammation under control, and you can do that. Control infectious inflammation or mold toxin inflammation. I like using curcumin to do that. The product I like using is a product made by Thorne called Mariva 500. And that's 1 pill 3 times a day. All right. Third thing you want to do is repair the fatty cell covering. So your nerve cell membranes are made up of a bilipid layer of fat, a bifat layer. And that can get injured in these illnesses, and you can repair that. The other thing we know that happens in neuropathy is you also have injury of the cell energy factories called mitochondria. And they exhaust their energy supply, and therefore they can't help step in to help give you energy to fix things too, all right? So you can repair the cell membrane and the mitochondria membrane the same way, and that is to do something called phospholipid repair. And the product I like to do that is something called ATP 360. It's a product by Research Nutritionals that is composed of a variety of phospholipids that have been shown to be effective at improving mitochondria function, and a cognitive function, I believe, is an indicator of neurologic function. And the way that you take that is 3 pills 1 time a day. And then finally, the most powerful antioxidant that we make in our body is glutathione. Glutathione is made in every cell. Its job is to fix things, okay? It's supposed to fix things from the inside. But if you got something that's injured, it will have exhausted its glutathione supply. So you need to put it back in. So I like using liposomal glutathione to do that. And the product I like using for that is something made by Thorne, which is called Trifortify Orange or Trifortify Watermelon, 2 flavors, all right? And you want to do 5 milliliters of that 1 time a day, which is about 400 milligrams 1 time a day, all right? So the way my approach would be to small fiber illness, if it's not too severe, if it's very severe, I might look at IVIG. But if it's not too severe, I would treat Lyme, Bartonella, or your mold toxin problem if that's what you got. Get rid of the thing that's insulting them. Okay. Number 2, I would try to get inflammation down. That's the curcumin. And number 3, I want to repair the covering of the nerves as well as the covering of the mitochondria using phospholipids found in the ATP 360. And then number 4, I would want to be on glutathione to do antioxidant repair of the damage. Okay. Now, I rarely use IV antibiotics anymore. Most antibiotics that we have, even the oral antibiotics, have the ability to cross into the blood-brain barrier. Ceftriaxone has enough problems that develop because when you have to put an IV line in and leave it in, and those IV lines can develop blood clots, and they can get infection that get into your body. And I think for the most part, we can do almost as well doing oral antibiotics. And so that's my approach from here. Okay. All right. Thanks for that question, Sandra. Good luck to you. Oh, I'm going to do a screen share. Let me show you the article I've written about how to fix neuropathy. So take a look at the brain and nerve section here. Take a look at my article called Peripheral Neuropathy and Repair on Lyme Disease, okay? All right, good luck to you, Sandra. Hello, Harold. Let's see. Does supplementing with glutathione make the body lazy and not produce its own anymore? Or do you think that's true for hydrocortisone, insulin, or stomach acid also? What are the symptoms for someone who doesn't tolerate glutathione? Well, someone mentioned to me it has something to do with sulfur pathway. Appreciate your help. I don't think there's any specific symptoms about not tolerating. I mean, if you're getting really nauseated on it, I'd stop. If you take it and you feel worse, I would stop. Okay, those would be things that I would look at. All right. In terms of, so I don't want to confuse giving glutathione with giving hormones. All right. So your hormones, the level of your hormones, like testosterone, like cortisol, like DHEA, are all regulated through a system called a feedback system in the brain, where the brain interprets levels and sends out signals to those respective organs and says, make your stuff, okay? So the brain sends a signal to the adrenal glands telling it to make cortisol or to make DHEA. And as the adrenals make more DHEA and cortisol, those levels rise, and the brain interprets that and starts sending less of a signal to the adrenals to make this stuff, okay? All right? So the brain regulates this. Now, if you take cortisol or you take DHEA, the brain is going to interpret that as having adequate levels, and it's going to stop signaling your adrenals to make as much, all right? Okay. Now, that's a different system than glutathione. I don't think we have a feedback system like that in glutathione. I think the main thing that would happen if you don't need it is you're just going to pee the stuff out, basically, all right? But it's not going to turn off your body's ability to keep making its own, all right? Let's see here. Yeah, anyhow, there you go. Good luck to you, Harold. Hello, Carter. Let's see. Do you suggest supplementing calcium and magnesium and manganese? Some say don't supplement these things because it feeds the bugs, and then some say you get what you need from food. Are there any supplements that you would consider universal to supplement? Thank you for your time. All right. So I do not subscribe to the theory that says starve your germs and starve you. Okay. So for instance, we need manganese to live on. We need magnesium to live on. We need calcium to live on. All right. Just because those also happen to support the bacteria that live in us, well, that makes sense. The bacteria is designed to live in the things we live in. Okay. All right. I believe at times, depending on your situation, it's good to supplement. So if you've got a lot of muscle achiness, taking magnesium can help. If you've got a lot of headaches, taking magnesium can help. Okay. If you are a woman and you have brittle bones because your hormones are low, taking calcium can help. All right. So anyhow, I don't subscribe to the theory of not taking these things. In general, for most of my patients, I just want them on a broad multivitamin that is made up of vitamin Bs, a number of antioxidants, and some minerals. And if you're looking for an idea of what I like using, I can just show you real quick so you can take a look at these later. So let me just do a screen share here for you. All right. right, so this is my supplement store. I think many of you are familiar with it. Anyone can buy from here. So if you're looking for a place for some of the products that I've been discussing tonight, feel free to get them from here, okay? All right, so let me see here. In terms of a good multivitamin, actually, I need to change that one around a little bit. Let's do this. Let's go here. Okay, so these are some of the supplements that are found with that have ingredients in that I mentioned in my Ross Lyme Support Protocol. All right, and here is you can find the vitamins I recommend. So one of the ones I recommend is this Physicians Daily by Thorne. And as you can see here, it's got a number of antioxidants like vitamin C, vitamin D, vitamin E. It's got some B complexes in here. Got zinc and selenium and some manganese and chromium and molybdenum at levels that are thought to help the body run, iodine to help your thyroid, for instance, okay? Anyhow, this is one example of a kind of one I would look at. Another one, if people have a lot of sensitivities, I might look at this Mediclear product by Thorne. It tends to avoid things that would cause sensitivity. In addition, it's made up of a number of things that help support liver function to help improve detoxing as well too. Okay. All right. All right. All right. I think my screen just shared. I hope you saw that. But if not, it's at my supplement store, which is treatlyme.com. And take a look at Mediclear and take a look at the Physicians Daily. That would give you an idea of the kind of nutrients I like using. Okay. Hello, Thomas. Let's see. Are there things that you can do for your thyroid beyond selenium and iodine if you have old-fashioned physicians that aren't down with full thyroid panel testing, or is the only option really to get prescriptions for T3 and T4? So one of the things you could do, so, I like working with the micronutrients that help your thyroid work, which is the selenium, zinc, and iodine can be things that can do that, okay? All right. The other things that can be helpful, though, is to do ashwagandha. So ashwagandha is an Ayurvedic and Chinese medicine herb that's been used for thousands of years because it's observed to give people better energy. What we know from animal models is that the thyroid functions better. That's one of the reasons they have better energy, okay? So a basic program I'll use, even sometimes before I put people on prescription medications, is to do an ashwagandha and then also have them on supplements that contain the zinc, selenium, and iodine that I mentioned too, okay? All right. Also keep in mind that the ashwagandha supports the adrenals, which also helps support thyroid function as well too, okay? All right. Good luck to you, Thomas. Oh, in terms of the ashwagandha dosing, I usually like to use 400 milligrams, 2 pills in the morning, and 2 pills between 1 and 2. Okay? Something in that range. All right. Hello, Kate. Let's see. Do you ever see loss of immune intolerance? Oh, I think we talked about that earlier. Sometimes people write the message twice. They think I'm going to see it better that way, so that's why I read them twice sometimes too. All right. Oh. Hello, Brandy. Let's see. What is your take on blood sugar and insulin resistance? Some say to spread out 8 hours between meals to give the liver time to recover, and others say you should snack every 3 hours to keep from having hypoglycemic spikes and drops. I inadvertently was eating a low-carb diet and went into ketosis one time, and my joints felt great, but I was so tired and weak. I'm assuming that's blood sugar, but I don't know. Thank you. Can elevated insulin levels be related to Lyme, or is it something else? Any suggestions? Thank you. So the only part of this I'm going to really be able to comment directly on is I have never seen elevated insulin levels as part of Lyme. I usually think of it as something separate, okay? And beyond that, I would have you talk to your regular doctors about the rest of your question there, okay? All right. Good luck to you, Brandy. Hello, Juliana. Let's see. Hi, Dr. Ross. I did a stool test, and we already answered that one earlier, too. All right. Well, I'll tell you what, everyone, I'm going to actually call it for the evening here. So it's been good being here with you tonight. For those of you that are still here, it's like we got a number that stayed here to the end. Take a look at your email tomorrow morning between 9 and 9:30, and you'll see an email from me announcing that the recording is done, and you can take a look at it. It will include a summary of what we talked about tonight here as well, too. Okay. And then I also include links in there so you can sign up for next week's, the webinar that is in. I'll be off next week, the week after. So 3 weeks from now will be our next webinar. So I'll be visiting with you all after Thanksgiving. So I'd also like to close this by saying Happy Thanksgiving. I know it's a little bit early, but I won't be with you until afterwards. So I hope everyone has a good holiday here in the U.S. I think Canadian Thanksgiving, have you all had it already? I think you may have. I should know, but I don't off the top of my head. So anyhow, good night, everyone, and good being with you here again tonight. And I look forward to seeing you all in a few weeks. Okay, bye-bye.